Good morning, good afternoon, good evening, whatever time it is you're watching this. Welcome. How was your week? Anything interesting? Did you do anything fun for yourself? What? I'll tell you what are you drinking this morning, and then I'll tell you about my week. So I'm actually drinking. It's called Blue Moon Magic by Cara Naturals Tea. India is out of California. Oops. Oh, there we go. That's what it's trying to show. But yes, it's really good. I thought it was fitting. It has there's like 5 ingredients in it. One of the ingredients is or herbs. One of them is ashwagandha, which is known as a super herb in herbology because they call it a super herb because there's so many things that it's good for. So I thought that was kind of fitting for this morning when we're talking about cervical cancer. So yes, um, but I will definitely get more into that tea um, when we do our tea series. So I'm hoping to do that maybe in a couple of months. So yes, excited about that. Definitely staring out the window. So this week we got a little snow. Maybe not even an inch of snow. Makes me a little nervous for fire season. So I'm hoping that before time's up, that we'll get more snow. One of Sean's colleagues had said that one year it had like snowed in June here. So crazy, right? So yes. But also my week. I know I told you a few months ago, my mom's oldest brother, my uncle, was diagnosed with pancreatic cancer. He passed away this week, so my thoughts are definitely with his family and my other 2 uncles. My mom had 3 brothers, so the oldest one passed. My mom's gone, my grandmother's gone, so it's just my 2 uncles. But one of my fondest memories of my uncle was when I was young. We'd go visit my grandmother, and when we would leave, we'd give him a hug bye, and he would throw me up in the air. I used to love that. It's my favorite thing. Is from throw me up in the air. I was so sad when I started to get too big for him to throw me up in the air like that. But yeah, that was one of my fondest memories of him. But anyways, so January is Cervical Cancer Awareness Month. So cervical cancer falls into gynecological cancers, but it is not the same as ovarian cancer. So let's talk about myth versus fact. Myth. Cervical cancer is genetic. Cervical cancer is not genetic. Fact is, it's primarily caused by persistent HPV, the papillomavirus infection. It's not inherited genes, though family behaviors like smoking can play a role. So, myth. Pap smears catch all gynecological cancers. Pap smear and HPV test are specific to the cervix and don't screen for cancers of the ovaries, uterus, or fallopian tubes. Pap smear test alone can miss cervical cancer. You need to make sure that the HPV test is included with your pap smear test. So keep that in mind. When you go have your physical or if they do a pap smear, ask them if the HPV test is there. or with it and asked to include it. So I didn't realize that. Pap smear. I didn't, realize there was two together. So pap smear is a pap smear. So pap smear, HPV, you want those tests done. I did know that a pap smear would not, would not catch like other gynecological cancers, but I didn't know that about the pap smear and HPV test. Myth. I'm not sexually active, so I don't need screenings. HPV can be spread through skin-to-skin contact, which I didn't know that. Not just intercourse, and can stay dormant for years. So regular screenings starting at 21 is vital. So yes, keep that in mind. That's crazy. Skin to skin, that's crazy. I guess I kind of knew about the dormant for years. I mean, you got to think about it in some sense. Like a lot of cancers can be very dormant for years and may never even may never be triggered or activated as cancer cells. So yeah. But so key facts to remember. Cervical cancer is largely prevented through the HPV vaccination and regular screening, and can be cured if detected early and treated promptly. I still remember when the HPV vaccine came out. At that point, I think I was too old for it, I want to say, because I feel like when it first came out, it was just for I think 21 to 30 or 18 to 30 or something. It was definitely for the younger side, and I was over the age limit of what they were offering it for when it first came out. So also cervical cancer is the fourth most common cancer in women globally. That's crazy. With around 660,000 new cases and around 350,000 deaths in 2022. That's a lot. And that's just with cervical cancer. That's not including like breast cancer or ovarian cancer or any other cancer that we get. So what do you want to look for, and what do you look for when do you consult your doctor? Right? This was also interesting to me because some of this I didn't really realize either, that were also common symptoms for cervical cancer. Unusual bleeding between periods, after menopause, or after sexual intercourse. Increased or foul-smelling vaginal discharge. In men, I know this may seem a little not your thing, but some of these things it's good to know. So in case your significant other or your partner, your wife, your daughter, sister, or someone you care about says some of these, because some of them aren't as intimate symptoms. So for you to know what they are is really good, because if they say something, then you can kind of encourage them to go get it checked out. I know the first two were kind of intimate symptoms, but the other ones not quite so much. So you have symptoms like persistent pain in the back, leg, or pelvis, which I wouldn't even think of for cervical possibilities of cervical cancer or a symptom for cervical cancer. Weight loss, fatigue, or loss of appetite. To me, that's just about any cancer. Vaginal discomfort. Men, I know you wouldn't know that, but unless they just said they're just they're having some discomfort down there. Yeah, I know you wouldn't know that. Swelling in the legs, very interesting. I didn't realize that either. So if you're experiencing any of those, men, if your loved ones are experiencing any of those, obviously the less intimate ones you would know, please encourage them to go get it checked out with a doctor. Have a physical. All right. So there are so many different organizations, nonprofit organizations, everything you can reach out to for knowledge, for research, for assistance, or even just for support. And when I say that, like that community support, to see that there's other people going through the same thing that you're going through. Sometimes it's kind of nice to feel like you're not the only one, because sometimes you feel like if you are, you're crazy, but you're not. You're not the only one. So you have there's like Till Diva. There is the Till Butterfly. There's Ovarian Cancer Research Alliance. So there are so many of them out there. You can just look at it. So Till is kind of like the gynecological color awareness for cancer. Even though it's for ovarian, a lot of it's for ovarian cancer is kind of the main one, but there are so many different types of gynecological cancers that if you do Till, you can go through and find what you're looking for. And even to another way you can look, you can go to like one of these like Facebook pages, like Till Diva, and see who follows them and who they're following. And you can find organizations that way as well. And so a lot of them are going to be like the smaller organizations, and sometimes the smaller organizations are a little bit better than the larger ones. They seem a little bit more personal than the larger ones, from my experience. So, but I'm not knocking the larger ones, because sometimes the larger ones can help. So yes. And don't forget, you have, if you need to get frustrations out on your cancer, Shoot the Cancer has, the target boards for, they have it for cervical cancer as well. So yes, make sure you check them out. All right. Until next time, have a wonderful week. Go do something for yourself and take care of yourself. All right. And we'll see you next week under the willow tree.